Welcome to Season 8 of the Lighting Your Way podcast. Hi, I'm Betty Long, your host, and this season we are giving the microphone to those who matter most, our patients. Join us as they share their personal journeys, offering candid insights into their experiences, challenge, and triumphs. For cancer patients especially, clear communication with healthcare providers is often a challenge. Medical jargon, rushed consultations, and lack of empathy can leave patients feeling confused and overwhelmed. Misunderstandings about treatment plans or prognosis increase anxiety, making it harder for patients to make informed decisions and feel supported in their care. In this week's episode, we talk with Marc Czarkowski, a lung cancer patient who opens up about the frustration of navigating unclear communication from his treatment team. He shares personal stories of feeling lost, unheard, and confused during his treatment and discusses the impact it had on his cancer journey and well-being. Marc Czarkowski, welcome to the podcast. Thank you for taking some time to be with me today.
Thank you so much for having me. I really appreciate it.
Yeah, I am glad that you are willing to do this. It's sometimes, you're not feeling so well and stuff, but I really appreciate your time. So this season we're talking with patients, right? We've been doing the last couple of seasons talking to our nurses and having them tell the patient's stories, but we thought we'd switch it up this season, and that was thanks to you, really, because when I know that we've been talking throughout your journey with Rebecca, your wife, and I just thought it'd be kind of cool to have you on rather than
I really
her.
appreciate that. It's just good to get it from the source.
Exactly. Why not, right? So, Marc, tell us. I know your journey, but share it with our listeners. Tell us about your journey with cancer and how you first discovered you had it.
Okay. So, what first happened was I was really struggling with fatigue, and at some point in time, I developed a cough, which was producing blood. And that's enough to scare anybody into a doctor trip.
Right.
So I went to see my primary, and she ordered up a bunch of tests for me to go through and do a little investigation as to what's going on. And of course, they found cancer, or they found a tumor, I should say. They weren't, definitive on what it was yet. And
Okay.
so, from there, I began the process of determining what it was I had and how we were going to go about treating it.
And when was that? Well, how long have you been dealing with this?
I would say that is maybe a year and a half ago, maybe almost 2 years.
Okay. And what kind of cancer is it?
I have lung cancer. It's stage 4 inoperable lung cancer. I had a tumor in my lung, and I had a lesion on my brain, which makes it stage 4. The inoperable part comes in because the tumor itself is located in a very hard to reach spot in the upper portion of my lung, which is difficult to reach. It's also the tumor is connected to my aorta, so that causes additional problems with risks to my heart.
Right.
And in addition to that, it's also in a part of the body that has a lot of nerves, that like a central nerve like switchboard in your chest that happens to be right there where the tumor is. And that's where my pain comes from, is because the tumor's sitting on a bunch of nerves. So the pain I have isn't necessarily because of cancer, but a symptom of the cancer.
Okay. And you're being treated for the pain because stage 4. Okay. So have they been able to effectively manage that?
Yeah, I am in a mostly comfortable state most of the time, and I have things to help me deal with it when it becomes more than that. I have medicines I can take when the pain is worse than normal, but I take uh, things on the daily that help me to live with the pain.
Okay. So tell me about your the treatment that you've had in the last year and a half. Are you currently being treated for the cancer?
Okay, so I went through a full course of chemo, which I guess was the better part of almost a year of regular chemo. I did immunotherapy in addition to that, and I did 30 plus radiation treatments
Wow.
daily. They were literally every day for 30 plus days of
Wow.
direct radiation. And so between those three things, they were able to shrink the tumor considerably. They were able to get rid of the lesion in my brain.
Okay.
Excuse me. And get me to a point where my cancer isn't necessarily growing or doing anything. I still have cancer, but it's not, I guess, as active as it would be had I not gone through all that stuff.
Okay.
And at this point in time, it's not currently spreading anywhere. And I'm just on the observation list, I guess. I do CAT scans and MRIs every 6 weeks to monitor, to see if there's any new growth and to see if. Um, so it's an inevitability that I'll have to deal with something again. But as of right now, I'm not doing any actual cancer treatment.
And during all that's a lot right there. Radiation, chemo, immunotherapy. Did you have any? I'm gonna say any, but I'm sure you had side effects. What were the most significant ones that you had?
It really kicks your patootie. I was just so sick, very weak. Um, it, it really breaks you down. It has an effect on every aspect of your body. In order to kill the what's making you sick, they make you very sick. And so I had I'm sure some people had it worse than me. I'm sure some people had it better than me, but it's the side effects were pretty terrible. Taste and smell, everything smelled of chemo to me, and everything tasted like chemo to me. And again, you're just so sick from it that your ability to do any regular tasks, I mean, just forget it. I pretty much spent that period of where I was in my most heavy treatment, I just spent in a chair. I really did very little in the way of any kind of activities that would be considered productive.
Yeah, you were probably exhausted, right?
Yeah, for sure. A lot of sleeping. It's been now I think 3 months or so since my last 3, maybe 4 months since my last infusion of anything, and I still feel it. I don't feel the chemo as much, but from the immunotherapy, I still have side effects, and they say I could have side effects for up to 2 years from now. That these things linger in you, and they attach to the parts of your body, and you still have feelings of it and side effects from it. Hopefully the side effects are worth going through.
Right. I mean that we've heard that so many times at Guardian Nurses in terms of what the immunotherapy does. Well, it's very effective. It can have significant side effects, and a lot
For
of
sure.
patients deal with them. To your point.
Rashes, and it affects the way you sleep, affects the way you eat, it affects just every aspect of your life. Some of the rashes and things like that were really put aside by my team to let's deal with this after instead of dealing with it during. And I don't really know their reasoning behind that, but so some of the things I had to live with a little longer than I would have cared to. Yeah.
Like rashes. That's
Yeah.
right. No, and they're triaging your health and your cancer. They're probably not worried about your rash.
Not worried about
that way.
rashes. Yeah.
But to you, to you though, it mattered, right?
For sure. Sure.
Yeah. They're not minor detail. Don't worry. We'll deal with the other big stuff.
You're itching like you have chicken pox. It's no fun,
Right. So when you think through it, like what's been, I know there's probably been a lot, but if you can identify one aspect of living with stage 4 cancer, what's been the most challenging for you?
Wow, the most challenging. It's been a very big change of life for me. I've been forced into early retirement, which I had a very physical job, which I can no longer do. I can't drive anymore because of the drugs that I'm on. And that's a giant change. I've lost, a lot of my freedom. Obviously, how it's affected my family and what it's like to have, a sick parent for my children or a sick husband for my wife is, I can't even, gauge what that is for them. Being on this side of it, it's, it's difficult to see that look in their eyes sometimes, and you wonder, are you going to be there for the important things? Are you going to be there for, weddings and grandchildren and, excuse me, and things that are important to life that you've always imagined you'd be there for.
Right. So clearly, while the physical have been certainly a challenge, it sounds like more emotional, right? And
both. Yeah. The physical, I make it a point to try and get out of the house and try and do some walking. It helps to do a little bit of exercise. I'm not exactly running marathons, but to walk for a couple miles is really, really very good for me. And it does, I get winded, and it's sometimes taking a couple of mile walk feels like I'm running a marathon because, I'm sweating and I'm wheezing and, whatever. But I have found that it's really helped me doing that. It helps my physical and my mental well-being to do that.
And your care team is encouraging you to do that and stay active as much as you can.
And pulmonologist is thrilled when he hears that I take walks like that. And he's like, wish everybody did. Right,
true. But a lot of times they can't get off the couch, right, or the chair because they're exhausted.
It's a struggle. Yeah, it's not easy to do, and I certainly don't blame anybody who doesn't. We all have our own journey with this stuff.
I'm going to ask you about the dogs. Are they helping you to get out, or are they just kind of adding to your stress?
They have been wonderful company for me for this. And during my treatment, we became empty nesters, and having the dogs around have been awesome company for me. And they are poorly trained and silly as could be, but I love them and they keep me good company. They do not aid in my exercise regime at all, because they're both kind of lazy themselves. But maybe they make me get out of my chair maybe more times than I would. But no, right. They don't add to my exercise regime.
That's funny. Where are you going, Dad? Sit back down.
Yeah.
Funny. Well, have you noticed any change? Because animals, and certainly dogs, I know there's been a lot of studies with like cats and dogs that can pick up stuff, right? So have they been more attentive to you since you were diagnosed? Have you noticed that at all?
I have one dog in particular, just never leaves my side and is super protective of me. When people come over and they, a lot of times I'll be in my chair when people come over. They lean over me too quick or anything, he will lose it because he's just worried about me, and he's wants to make sure that I'm okay. And so there has been
that's cool.
And the other one doesn't know so much. He's kind of in his own little world.
Happy-go-lucky.
The one is looking after me for sure. Yeah.
That's cool. Yeah,
Yeah.
I've heard that a lot from patients who've had dogs, and even when you think about pet therapy, right? How important it is for patients who don't have a family or support to have animals. So
Oh,
I can
it's
appreciate that.
huge help to
Yeah,
have,
yeah.
something around you that cares that much about you, and it's just only a source for joy. It's really nice to have them around.
Cool. I'll let them know that. And give them an extra treat after this. So,
For sure.
Let's talk about the journey of treatment. Right. That you are being treated at an academic medical center, which, does present its challenges with terms of communication, but also many benefits, right? Because you have the best and the brightest, hopefully, working with you. So what has been like when you looked at the journey? I know that, Rebecca's your wife, and Rebecca's part of our team and a very important part of the team, and was an oncology nurse.
Mhm.
But what, like, I guess from watching from the cheap seats prior to your being diagnosed to now being a cancer patient, what's been the most impactful to kind of think about the healthcare system?
Well, it's the resources, the technology, the medicines. It's amazing what can be done, and that aspect of it is great. And to be able to have top-notch facilities near us is wonderful. I take a little bit of issue with it in that you do become part of a factory setting.
Mm-hmm.
These are big hospitals with lots and lots of patients, and you can kind of just get into it's not the care is not necessarily so one-on-one and designed for you as it is designed to treat a lot of people.
Right. Right.
But the flip side of that again is that they have the financial ability to have top-notch equipment and a large staff and modern facilities.
Mm-hmm.
So to say there's a lot of people on board. There's a lot of moving parts when you have
Right.
the type of cancer that I have. I have a cardiologists and pulmonologists and oncologists and radiologists, and there's so many people involved. Some of them are more involved and more invested in your care than others.
Okay. Others are like just consulting, like let's talk to the pulmonologist.
For sure. You have a team, and your team gathers and collects data on you and discusses you in a board setting to determine the best paths of treatment for you. And that's really in and of itself amazing. That you would have a handful of great minds together in a room figuring out how to make you well again is pretty remarkable.
Do you feel like with all the great minds, like I don't want this to be a leading question, but what's been the greatest challenge that you've had besides the side effects and the fatigue, like in terms of the systemic challenges?
Okay, well that's another fold altogether. If I had not had, and you just said, I have a wife who's got all these wonderful credentials in this field. If I had not had my wife beside me and guardian nurses beside me, I don't know how I would have gotten any of this accomplished. As far as, people drop the ball all over the place. I still, I have my oncologist, I slipped through the cracks with my oncologist and I hadn't seen him. I went to see my radiologist and she was like, you hadn't seen your oncologist in months. And what's going on with that? And I was like, I don't know. They haven't reached out to me, And so like, there's this proactive thing that happens when you have people on your team that see this and can say, you need to do this, or I'm going to reach out to Dr. X and set something up for you. We're making our own appointments with MRIs. We're making our own appointments with CAT scans. Nobody's reaching out to schedule you for that kind of stuff, even if it's written in the system somewhere that you're supposed to have one. It doesn't just take place. And I am not someone who knows anything about any of this. So had I gone into this just being me alone going through this, I wouldn't have made it through step one. It's not in an incredibly intuitive or patient friendly system. I don't think. I think that I've had I've met with doctors that didn't look at a chart and just come in and just kind of winging it, and like, you haven't really looked at what's going on, have you? You really don't know what's happening with me. And that kind of stuff is unacceptable, and those are huge challenges because how are you gonna treat if you haven't seen the big picture? And I had mentioned earlier that some people are better at this than others, and I've had a pulmonologist who calls me after every MRI to tell me what the MRI says. He personally calls me and says, Mark, this is what I saw. This is the progress we're making, and this is what's going on. And to me, that there's tremendous value in that. To not me chasing him to see, hey, I had this MRI. What does it say? Or
reading it yourself on your portal and then thinking,
sure,
what does that mean?
Which is the case with and I do feel that for some of the people in my care, they're burnt out, they're tired, they're I don't know, whatever excuse you want to make for them, but like they're not as invested. And that is,
well, if they're not, when they're with you, do you feel like they're with you? I mean, they may not be with you once you leave the exam room, right? Because they're not calling you, they're not reporting on your CAT scan.
In my personal case, I don't feel that way. I mean, I feel like if I would bring a topic up to my oncologist, that he would, well, that's not how these things usually go, and you're a strange case, or you're but not really. Like, let's explore this. Let's look into why this is this way. Why are you feeling this way, or why? I had a period of time where my vocal cords stopped working, and that was due to the nerves that I had talked about before, and the cancer sitting on the nerves, and the nerves control your vocal cords. And I brought this to my oncologist, and he was like, does it hurt? I don't know what we're going to do about it. It was kind of like, I'd like to be able to speak and not make weird humming noises when I'm breathing. That would be good.
Kind of important, I think.
Yeah,
I don't know.
It may not be important to you, but it's kind of important to me. And so that kind of like poo-pooing things that were going on with me, I just felt was really not okay. And if it weren't directly involved necessarily with the actual treatment of cancer, that they didn't want to hear about it. And so many of the things I was going through was a result of things that I went through in curing the cancer.
Right.
So that has been a very frustrating aspect of this.
Mark, we hear that. So, I mean, I'm not trying to discount it, but I feel like communication is still, with all of the resources, right? The portals and the text messages and this and that, it's still the number one problem in healthcare because patients need to understand what's going on, and the doctors often don't have time. And it's not just the doctors, nurse practitioners, PAs.
For sure.
They got to see a bunch of patients, and if it's not hurting you or causing you any, I guess, a poor quality of life, depends on how you define your quality of life. But I guess, that didn't raise to the level of intervention, right?
Right.
Oh. Yeah, I'm sorry because you've been on this journey for a while, and to hear that, the frustration in your voice, I'm disappointed with our system again.
Yeah.
So the system's been frustrating. How about when you look at your own quality of life? Like, how have you maintained that? Talk a little bit about, how do you keep yourself sane?
Yeah. Well, I guess that's a good question. I have tremendous family support. I have tremendous friend support. And now that I'm outside of treatment, in active treatment, I should say, that I'm really maximizing my time with the people I have around me, taking some small trips, and excuse me, excuse me. Really just trying to live my life as full as it can be, with the limitations that I have. Reaching out a little more and having deeper conversations and these types of things that, there's not a lot of people that get the, a warning that, you better start living your life, pal, and I feel fortunate in that I have that. I know I'm not going to live the life I thought I was. So, but I do have this time. I got this right here, right now, and I need to put everything into it that I can. And it does get tough. I'm sitting alone in my house, more time than not, and boredom sets in, and it is hard to keep your marbles. But I do the best I can. I'm a pretty easygoing guy, so I try not to let the small stuff get to me. And it's all small stuff.
Yeah, when you look back, yeah, sure, right?
Yeah.
Are there any resources or kind of support networks that the care team has introduced you to, or maybe Rebecca, or anybody, any of your friends?
It's certainly been suggested to me. I have not participated in any of the resources. I know that there's there's men's groups and there's survivor groups and things of that nature that I could partake in. I just really haven't. And that's not to say that I won't. Just at this point, I haven't. So I really can't speak to them as to whether or not they're helpful or not.
Yeah, I mean, you were getting through the physical treatment, right? So
yeah, I'm pretty early out of that. I mean, it's been a few months, but now that I am getting it back together a little bit, I may participate in some of those things.
Okay.
Yeah.
Let me look downfield a little bit. Given what you've been through and all the insider viewpoint that you've had now, what would you, if another patient came to you and wanted to get your perspective on having stage 4 lung cancer, what suggestions or what would you share with them?
Wow. Well, if you could have a guardian nurse next to you, that would be helpful.
All right, Mark, I did not
That's a
do that.
shameless plug, but
That is not
but
that's not a setup question, honestly.
that's not a set of questions. But
No.
seriously, it made a tremendous difference in my care. So without that aside, what would I
Okay.
say to people? I would say take notes, bring people with you who will pay attention to what's being said in the room. It is very difficult to digest information that you're given very fast, and you don't always know what the words mean. And if you can, um, even record your appointments so that you can go
Mhm.
back and listen to them and try and get an understanding. It's a lot to take in, and it's a lot to take in at a very scary period of your life.
Right.
You're terrified. You're hearing things that are so unknown to you. They say, "Oh, you're going to do this, that, and the other," and you don't know what that means to you. What's that going to feel like? What's that going to mean for my daily life? And you don't know, and it's different for people anyway. So, like, even if they can tell you that some people
Right.
have this and some people, it doesn't mean you will. So all those things, there's so many unknowns. Educate
Yeah.
yourself, and really, if you can take the information that you're given from your caretakers and revisit it the next day and look at
Okay.
what was said, and try and have a better understanding of what was said. um, I know myself, I just kind of nod a lot and go and it's
Right.
not registering. I mean, it's not even
Okay.
uh, you know, a lot of it. And it was very helpful to have people in the room with me. So if you're comfortable with that, if you have a spouse or a friend or somebody that can come with you on appointments, I would highly recommend that.
Okay. Yeah,
Um,
and see, I heard you say educate yourself, but I often will say to patients, don't go on Google, right?
oh
Because
God, no.
right.
No, absolutely not. No, you will find the worst possible scenario every time.
Right.
And if you look at statistics, you'll be planning your funeral arrangements. And so that's not, no, that's not good. But there are resources that you can get from your doctor or from your PA about what you have and how it goes. And if they tell you you're going to be doing chemo, well, ask what's that going to be like, and
Right.
what does that entail. And I do find that when it came to treatment, and this was a point of real frustration for me early on, was the team was telling me what we were going to do and not asking me if I was
Oh.
okay with any of it.
Oh.
And that was
Oh.
that was a real problem for me. Like, I don't know that I want to do that. Like, what is that?
Okay.
No, we're going to go ahead and we're going to give you this surgery, and we're going to go ahead and we're going to start hitting you with this, that, and the other. And I don't even know what you guys are talking about. And you've just decided you're going to do all this stuff to me. And I really didn't feel like I had a voice in that.
Oh
And
wow.
and for
Did you
me, that,
did you push back? I mean, how did you deal with that?
well, yeah, I mean, then that's where the education part came in. Was like,
Okay.
before I agree to any of this, I want to know, what this does and how it's going to take place, and how does this increase my survival chances, and uh, you know ultimately, I agreed to most of everything. There was one or two things that I flat out said no to, and it, in hindsight, I'm glad I did. I don't think they would have changed my outcome at all.
Okay.
Um, and those were more invasive surgeries, that I can't say what the outcome would have been, but for um, the radiation and the chemo, there's plenty to be uh, to be found about what that's going to look like for you.
Right.
Yeah.
Well, and it sounds like, given what you'd said earlier about the location of it, it sounded like surgery may have been pretty risky.
Super risky.
Right.
And they couldn't, and, super risky and very little guarantees of any, I mean, not guarantees, but any,
benefit. Gains.
Yeah, any real benefit that it would be any different from doing the treatment that I was going to be doing anyway. Yeah, I mean, in addition to those surgeries, I still would have had to do the chemo and the radiation and all that stuff. So, but in addition to that, I could have put myself at a great risk by doing those surgeries because of the location.
Yeah, your heart, it's too risky. So if you had a pulpit that you could address the care team, and what would you say to them? How would you want them to change?
By care team,
your oncology, your team, your pulmonologist, all the folks that helped you.
Yeah, if I had a pulpit, I would say, just listen more to what the patient's actually saying. Follow through. The understanding that your patient doesn't have a tremendous knowledge of the medical field is something that gets lost along the way, and that dumb it down if you need to, but explain things and not just assume that that patients understand what it is you're talking about. I think a little more gentle care in the office, not in terms of the treatment, but in the office of people are going through some really really hard times mentally, and that it's a very difficult thing for people to go through, and I think that gets lost. So
do you feel like do you feel like people cared about you?
Again, some yes, and some absolutely not. I feel like some people were genuine, and to be perfectly clear, nurses who did the actual work from A to Z, the ones who actually gave me treatments and gave me radiation and gave me meds, were all just aces. Every last one of them was wonderful. I couldn't speak highly enough about the nursing care. This is really doctors that I'm talking about now. And I think that some doctors see you as a case, and some doctors see you as a human being, and it's obvious when you're walking into the room how the conversations go, and how you just kind of get rubber stamped and moved along with some people is just unbelievable to me. It's and I think maybe some people lose their way along the path of maybe doing it too long, or I can't speak to why it's that way, but I can say that some of the doctors I saw were very connected and in tune with my case, and really spoke to me as a person, not a case. And then others were very rubber stamp. This is what we do in these cases. Boom, boom, boom. Next, and just move you along. And that feels terrible.
I'm sure.
That does not feel like care.
And you don't even, you had cancer. I mean, there's other patients that we see that, are just going to have surgery for like a knee, and they have the same, same approach. You wonder, right? I've often said in the last couple of years, I guess since COVID, probably, that, the system is experiencing a crisis of compassion. And
sure.
Is it that we're just, because we go into it because we want to help people. I think everybody's altruistic in that respect, but somewhere along the line, maybe it's just too many patients and too much heartache. I don't know.
And I know
Yeah.
that the nurses are taxed, and I know that the nurses have a giant workload, and I don't know if the fact that they are with patients for so long and develop relationships. I don't know what
Mm.
what the recipe is that the nurses are so uh, gentle and okay and compassionate,
Mm-hmm.
and some of the doctors are not. I don't know what happens along the way there, but
Yeah.
yeah.
Yeah. That's truer words have never been spoke, Marc Czarkowski. I'll
Oh,
tell
thank
you.
you.
All right. Last question. What are
Uh-huh.
your hopes or aspirations moving forward? Like whether it's your health or your personal life, what would you, in the next couple of years?
Yeah. Well, you know, I hope to stay healthy for as long as possible, and to continue to enjoy my friends and family, and and maintain these friendships and relations in the absolute most loving way I know how. And if you're well and you haven't said you love yourself, you love your friends and you love your parents and whatever else, say it every day if you have
Yeah.
to. I had friends that would, you know, definitely think it was weird that I hugged and kissed them when I said goodbye, and now they don't. I hug them a little longer, I hug them a little harder, and if they're uncomfortable with it, too bad. It's just, it's kind of who I am now, and I would suggest doing that in your life. Tell people around you that you care about them and that you love them, and don't wait for them to be not here and regret not telling them that. It is amazing how people rally around when somebody gets sick.
Yeah.
It's just the amount of love that poured in, and the amount of friends I hadn't talked to in years that gave me a call to say, "Hey, I'm rooting for you." That kind of stuff was just unbelievably helpful to get me through it, especially at the hardest parts of it. Just getting an email or a text from a friend saying, "Hang in there, dude," was huge. And
Okay.
I would say to anybody to keep your friends and your family and the people you care about as close as you can. And my goals are just to keep enjoying myself, and I'll reinvent myself now that I'm on the other side of it. I don't know what I'm going to do yet, but I'll figure it out. I'm sure it'll be great, whatever it is.
Well, I didn't hear any Eagles Super Bowl victory in that hopes or
No, I
aspirations.
have my doubts. I have my doubts.
I
It
I
was
I hear you.
really,
I hear you.
it was really a lot of anticipation beforehand, and now I'm just
Yeah.
pretty resolved to the fact that I'm a fan in Philadelphia.
Right, right, right. We all know the heartache that entails.
Yeah,
All
for
right. Well,
sure.
Marc, thank you. I really enjoyed the conversation, and I
Thank you,
appreciate
Betty. I
it.
appreciate it.
Really. All right. Well, take care. I'll talk to you soon.
All right, take care. Bye bye.
All right. Bye bye. Thank you for joining us this week. You can find the Lighting Your Way podcast on Apple Podcasts, YouTube, Spotify, and Stitcher. If you found our conversation helpful, please share it with your friends and leave us a review. You can learn all about how Guardian Nurses helps patients and their families when they need it most at our website, guardiannurses.com. So until next time, find some joy in your life and pet all the good doggies and kitties, and remember to tell your people that you love them.